thank you very much for this opportunity. So I'll go straight to the point. So this is the outline of our 5-minute presentation. So a little bit about ICAP. It's an organization where I work with, a local organization working to tackle challenges in HIV, tuberculosis, malaria, maternal and child health, non-communicable diseases, and most recently, COVID-19. So the work on the project that is being done in Cameroon to control the HIV epidemic includes actions that fight against gender-based violence amongst people living with HIV, and this is as a result of a teamwork between ICAP local workers and supported ICAP workers from ICAP Columbia University in New York. So, index case testing is an efficient approach that has been identified to achieve epidemic control, and it helps to identify potentially exposed partners and offer HIV testing to these exposed partners. However, disclosure of HIV status may increase risks of gender-based violence and other forms of violence such as intimate partner violence, which can lead to deferral of partner notification, thereby hindering the work against HIV in the country. So ICAP has been working in the northern zone of Cameroon, which is made up of 3 regions in 85 high-volume sites for the past 3 years. And for these past 3 years, we have been able to scale up the number of people living with HIV from about 40,000 when we first started to about 72,000 by the end of September 2023, amongst which, like similarly to other countries, majority, which is 66% of these people living with HIV are women, and 33% are men, a ratio of about 2:1. The culture in the northern region of Cameroon, which you see highlighted on the map of Cameroon, is predominantly a patriarchal Muslim culture. And in this context, gender-based violence is common but rarely reported in the health facilities or anywhere else. So as recommended by the World Health Organization, building capacity of healthcare workers on how to identify and manage gender-based violence is necessary. So, healthcare workers from HIV care and treatment units were trained on the management of gender-based violence using the LIVES approach. And standard operating or procedures based on this approach were conceived and distributed to the health facilities we are supporting in order to help facility staff systematically screen all people living with HIV for gender-based violence at every visit. So data collection tools were equally developed to help capture the work being done in order to mitigate gender-based violence amongst people living with HIV. And healthcare workers were also mentored on the use of these new SOPs and also on the how to document in these data collection tools. So those who were screened positive or at risk of gender-based violence were sent to units where they could obtain proper care. So as results obtained, by March 2022, we were able to train 52 out of 85 of our supported health facilities on the management of gender-based violence based on the capacity we had, with 183 health providers covered. All the sites were provided SOPs followed and registered, followed by mentoring and coaching on how to use them. And by the end of the fiscal year 2023, a total of 96 cases of gender-based violence were reported among HIV patients. And the ages identified, which were similar to the presentations of the first session, were ranged from between less than 10 years to 39 years of age. Majority of the cases that were identified were women. That is, they made up 90% of the population, and only 9% were males. The majority of those who were reported among the females, again, were young girls and women, aged between 10 to 19 years old. And of these, of the 87% of these females that were experiencing gender-based violence, we had 87 that experienced the sexual form of gender-based violence, and 12% who experienced the physical form of violence. So in conclusion, the patriarchal culture makes survivors hesitant to come forward in the northern regions of Cameroon. So young women, especially those of the adolescent age group, seem to be more vulnerable to HIV and sexual violence. So this project demonstrates that appropriate training of healthcare workers about gender-based violence is a first step in prevention, identification, and management of gender-based violence amongst women living with HIV at facility and community levels. And this project equally demonstrates that progress towards these goals can be achieved even in a highly patriarchal society. So we recommend capacity building of healthcare workers on the management of gender-based violence amongst HIV patients, and the general population that should be scaled up. Qualitative studies could also be carried out to identify the root causes of gender-based violence among people living with HIV. Specific attention should be directed towards young women and adolescents when screening for both gender-based violence and HIV. Health systems should equally strengthen themselves to ensure quality response to gender-based violence victims in accordance with the LIFES approach. So this work has been funded by PEPFAR, and we thank you for your kind attention.